We reached the town of Ago-Iwoye in the Ijebu North local government area of Ogun State. Our intention was to visit a community in the western part of the town, where we plan to discuss and address various issues and activities within the area. We drove down the city and the journey lasted for about 20 minutes.
As we approached the entrance of the community, we were greeted by a molded concrete structure that is bearing the inscription of Ministry of Agriculture, Farm Settlement, Ago-Iwoye.
The idea of establishing farm settlement around the western region was initiated by the Western Regional Government under the leadership of the late Premier, Chief Obafemi Awolowo. And the purpose of this establishment is to enhance food sufficiency through the provision of a dedicated space for agricultural activities. The government aimed at providing necessary infrastructure such as irrigation system, storage facilities, offering support and training to the farmers.
The narrow road led us into the heart of the camp, where we parked our vehicle and began exploring the area on foot. Although farming activities still take place on the settlement, but all we saw most were overgrown weeds, crumbling fences, and abandoned buildings. It was so disheartening to think about the wasted opportunity and the loss of what could have been a beautiful and productive farm that could ensure a high level of food security. We came across an elderly man working on a small portion of land. He was eager to share his experiences with us. He highlighted the lack of accountability and responsibility among beneficiaries in making most out of the resources provided to them is part of what brought the settlement to where it is today. We moved on and continued our exploration. We stumbled upon a palm oil refinery where palm kernel is transformed into palm oil. Workers at this refinery welcomed us with open arms and were eager to share their knowledge with us. The workforce in this area constitutes 90% females that are aged between 20 to 60 years and comprises the outsiders who commute to the camp to work and depart once their shift ends. One of these workers took us to a building where the raw materials are kept. At first, bunches of palm kernel has to be shattered for easy removal of the seeds. The broken bunches were then set aside for approximately 48 hours to facilitate the removal of the seeds. In order to separate the palm kernel seeds from unwanted particles, they were then poured onto a jagger, a specially designed iron tool that is used for this purpose. As you can see, the seed descends directly downward, while the unwanted particles are caught in the iron grate below. After the palm fruit is obtained, it is carefully packed and loaded into a drum for sterilization. The purpose of sterilizing the palm fruit is to soften the pulp of the fruits and facilitate the stripping process. Once the sterilization process has been completed, the seeds are then taken to a thrashing machine. This machine grants and enhances the easy absorption of the oil from the seeds. The kernel are now ready to be processed further. The kernel are then taken to a palm oil pressing machine. This machine crushes and presses the kernels to release the oil. The oil is then separated from the solid through a filtering process. Liquid product obtained from this process is still impure, as it would consist of a black solid substances, which has to be extracted through the filtering process. For the filtering stage, liquid obtained from the previous process would be poured into the crude oil clarification tank that is being placed on a fire for a serious steaming. After some few minutes on fire, the oil will be left to cool, and as a result, the solid black particles, commonly known as kotopo by the locals, can be easily extracted from the oil. Finally, the clean crude oil is introduced into the crude oil tank for temporary storage. We left the refinery and came across the community health center, and we decided to visit. Although there are local healthcare services and dedicated medical professionals available in this community, but the clinic is seeing a low number of patients. This trend is alarming, as it indicates that many residents are not prioritizing their health and well-being. At times, patients frequently decline injections because they perceive them as having a negative impact on their lives. Could be various reasons for this poor turnout, such as lack of awareness about available healthcare services, financial constraints, or simply neglecting their healthcare due to busy schedules.
Except anything you want, I encourage you. Bọ́lá bá títí ìyẹn compulsory. Tó bá ti fi lóògùn, wá persuade wọn títí wá padà bẹ́ẹ̀. Bá ní wọ́n dùn, tó bá ní wọ́n dùn. Few nínú ọmọ bí ọmọ tó wà ní town tó ti máa ń gba injection tẹ́lẹ̀. Àwọn yẹn bá wá, èdè fún injection. Wọ́n sọ pé rárá. Wọ́n ti kọ injection báyìí wọ́n sọ pé cancel. Èmi máa sanwó ẹ̀bùn kò lè padà wá. Wọ́n sọ pé gbọ́dọ̀ lọ jẹun kò ní lọ.
Bó ṣe wà ní sí ní fojú òun pé wọ́n láàkì medical education ojú tẹ̀mí fún wọn ní so ṣé any program tẹ máa ń ṣe wá ẹ̀kọ́ máa pé gbogbo wọn jókòó tẹ máa dá wọn lẹ́kọ̀ọ́ nípa health.
Ẹ lè para ọkọ̀ jókòó lẹ́yìn ká fún wa gbé
megaphone òun náà mú sọ lọ́wọ́ kan bẹ́ẹ̀ ṣe máa ń ṣe àwọn.
aṣèkọ́ ní last 3 sábà lọ ní alẹ́ yẹn alẹ́ ìwọ̀n gbọ́n wọn sí wà nínú àwọn gbé megaphone àwọn ẹ̀sìn lẹ́yìn ìyá ẹ̀ lè pè wọ́n jókòó wọn sọ wípé àwọn wà nínú àìṣe àwọn tó wọ́n sọ wípé iṣẹ́ àwọn kí lọ́kọ̀ wọn tó ń ṣe epo yẹn wọ́n ní ìsìnkú wọn àbúrò lè dání lò tẹ kò lè mú ọ̀lẹ́ ẹ má tí wọn àwọn strategist àwọn tí yẹn bá ń ṣiṣẹ́ ẹ ti mọ̀ pé ẹ̀ lè pè wọ́n bá tí wọn kì í sílẹ̀ bá ṣú sínú tàbí ẹ̀sọ́ tó ní gbọ́ ọjọ́ yẹn wọ́n gbọ́ ẹni tẹ̀fẹ́ sọ wọ́n á gbọ́ nǹkan tẹ̀fẹ́ fẹ́ sọ wọ́n dẹ̀ lé sí submit àti gbà ẹ̀gbọ́n bẹ̀ sí ní gbogbo bẹ̀ sí ní wá center àti wá complain torí wọn kì í wá lẹ́wọ́ sálọ bẹ̀ sí ní wá ṣàmọ́ wọn gbọ́ tí ìmọ̀ fi mọ́ àwọn tí ìmọ̀ bá ń ṣiṣẹ́ wá tí mo lapsis wọn ẹ̀sìn wọn tó wù sí ẹ̀sìn wọn tó ẹ̀ lè pọ̀ ẹ̀sìn kẹ́ni wá ṣe ní sínú àníkólóyún kan wá ṣe nínú antinata gan láwọn ọ̀rọ̀ ayé àṣìṣe máa wá wọn lọ lé àṣìṣe máa lọ polóyún yẹn wá nísìn ẹ̀wá ká ṣe antinata ẹ̀jẹ̀ pé mo kọ́ta máa ṣe wípé àdé sẹ́ńtẹ̀ gbogbo ọ̀tẹ́ bá sọ fún sẹ́ńtà yẹn láti sọ fún nínú ẹ̀kọ́ lè máa wá pẹ́ gba títì ní kẹ́lẹ́ máa lọ torí kò ní lọ wọ́n máa sọ fún yín pé àwọn ń lọ sóko ṣé táwọn ọ̀dọ́ lọ ṣe ní tẹ̀mù yẹn máa yọ lẹ̀ bẹ́ẹ̀ kọ́ gba immunization máa yín ẹ lo immunization àmọ́ yìí èyí ni o ẹ tètè dé o ẹ kọ́kọ́ gbọ́ wọn kẹ́ tó máa sóko